Hello there. You are watching COVID Fellows, a video interview series with the administrative fellows working through the pandemic. Hi, everyone. My name is Audrey Workman. I am an administrative fellow at Health Partners in Minnesota, and today I am joined here by a former classmate of mine, Riley Orrell, from Massachusetts General Hospital. She's out in Boston now, and she's going to share a little bit with us today about what she's doing to help her hospital and respond to the COVID-19 pandemic. But first, Riley, could you introduce yourself a little bit and tell us about your fellowship?
Sure. Thank you again for having me and for putting this all together. And it's been great to really see what other fellows are doing and to connect with some of our previous classmates to hear how they're experiencing the pandemic and what they're helping with. So thank you. Just to give a little bit of background into my fellowship, it is a 2-year rotation-based program. So I started about a year ago, and the first 6 months were in patient care services. And that is specifically designed as the first rotation so that fellows can have an understanding of what it's like to be a provider and a patient at Mass General, and what services are provided and what those perspectives are, so that moving forward in the rest of the rotations and in the rest of our careers, we can have that perspective and make decisions in mind with patients. And then I was on a leukemia and bone marrow transplant unit for that, working on various projects while also doing a lot of shadowing of various providers to gain that perspective. And then in January, I transitioned to my finance rotation and was there for about 2 months before the pandemic really kicked in, and things changed a lot ever since then. But the fellowship overall has been a great experience, a great opportunity to really learn a lot more about every different area of administration and to really figure out what it is that I'm most interested in. The fellowship specifically at Mass General is very well known, and there are a lot of leaders at the hospital who were previous fellows, and so because of that, the title already automatically carries a level of respect and appreciation, which gives a lot of opportunities that I'm very grateful for. And so that opportunity is also another great reason to do the fellowship, and has been great even throughout the pandemic.
Mm-hmm. Yeah, that's really nice to have. I've found that leaders who have experience working with fellows know the type of projects that we can really help with. Riley, are you in a cohort of fellows?
Kind of and kind of not. So there are 2 of us because it is a 2-year fellowship program. So I'm the first year, and then there's a second year. Okay. And then we also have a military fellow who comes from the Army Baylor program and does just a shortened 1-year fellowship every year. So there's 3 of us, which I think is smaller than most cohorts or most fellowships. But it's still nice to be able to have that connection, and especially someone who's been through the first year before, and I can ask questions and figure out what some of the questions that I might not want to ask other people, that she's been very helpful with.
Yeah, that's great. You had mentioned that earlier this year during your finance rotation, that's where you were at when COVID-19 started really impacting the Boston area. What has been the general impact of the pandemic there? Have you guys been hit pretty hard?
Yeah, Boston has been hit very hard, especially in comparison to some of the other states. We are currently up to over 90,000 cases. But we have already hit our peak, and so hopefully we will be coming back down shortly. We moved into our recovery phase at this point, but there were several weeks where It was increasing every day, and we had several hundred patients in our ICUs. We had to transition several of our general medicine units into ICUs, and of course, restaff all of those with nurses and providers who were trained to provide that level of care. It has been a big challenge. I think that the hospital has really responded well, though, and has been very prepared, and that has been really encouraging and comforting as someone who lives here, but also as someone who's been able to learn from them about how to respond in emergency situations.
Yeah, it's a big lift, right, for the healthcare leaders and healthcare teams.
Right.
So, Riley, how did your work change, and what were some of the things that you worked on during that time? And I'm sure you're still working on some of those things now.
Yes. So most of my projects have been put on hold, or some of them are irrelevant at this point, because it was, we were at a point where we were talking about where could we spend some money on certain things, and now we will need to be a little bit more cautious moving forward of how we spend our money, as most hospitals will moving forward. And I unfortunately probably won't get back to finishing most of those projects before my next rotation. But I have had other opportunities that have been really great through the pandemic. One, just being involved in the HICS committee meetings since January. Those were every day, they're now every other day. But being able to see and hear all of the decisions and everything that's going on at that level, and even at a few times report out for the finance team and some of those updates. But in terms of projects, the first 2 weeks of the pandemic, I was actually working from home, and I was helping our IT team build virtual waiting rooms and virtual offices for our telehealth platform. So we previously did some telehealth, and it was planned to be expanded, but we expanded it. I think the timeline was over a year or two maybe, and we expanded it in just a matter of like 3 days.
Wow.
To be able to meet the needs of our patients during this time, and increase the visits that were done virtually by over 400%. So that was something that I never thought I would be doing, and it was system-wide. So Mass General is part of a larger system, and so that was a good experience. But because of the demand and need for that right away, it didn't last past the first week or so. So then I reached out to my preceptor, I guess you could say. She's the CFO and the senior VP of the hospital, as well as a previous fellow, and basically just said, how can I help? I can probably do some work on my old projects, but it's pretty clear that they're not going to really matter at this point. So then she basically made me a chief of staff of some things that she was managing at the time. And one of those things was donations to the hospital, basically anything that's not finance or PPE related, but all the other in-kind offers to help. And initially, I thought that it would just be one of many things that I would be doing, and it slowly just grew over time to be almost the main thing that I've been working on throughout this time, just because everyone has been extremely generous and willing to give food, clothes, shoes, books, Keurigs, anything you could possibly think of, people have wanted to give to the healthcare staff on the front lines.
Wow, that's incredible. And I actually saw the social media post where Mass General featured you, and you talked about some of this work that you're doing. I love hearing about the community coming out to support our teams who are putting themselves at risk every day. It's inspiring.
Yeah, and it's really encouraging to bring the food or whatever is being donated to them as well, and it's neat to see their reactions and excitement, and especially during this time when it is pretty challenging for some of our units.
Mm-hmm. Yeah, it can be unifying and uplifting during these challenging times.
Mm-hmm.
That's a lot of great work, Riley. Thank you for sharing some of the things that you're working on. Is there anything else you want to mention that we can highlight?
I guess just thinking about the other people who have really helped and come alongside in this endeavor. Like as I said, I initially thought that it would be somewhat of a simple task alongside a lot of other things that I could be working on, and it grew and grew. So then I had some help from the labor pool. I initially had 7 people that were assigned to my team, which then grew to like 16, and now we're at almost 40 people who are helping out. And that has been a big change and has allowed us to be able to accept more donations, and has also allowed me to have some additional opportunities in managing a team and figuring out different things within my own leadership style that may be effective and some things that might not be effective. And so it's just opened up a lot more opportunities both for myself and for the hospital.
How does the work that you're doing now compare to what you were working on before?
It's very different, as the donations themselves weren't happening at all before this. And in fact, it is in violation of one of our policies that we've had to relax a bit as a result of this. So that's completely different. Having people on my team who report up to me is different. I haven't had that experience up to this point, at least not formally. And I would say that fellows at Mass General do already have a lot of exposure to high level meetings and decision making, but being involved with the HICS committee that I did already mention a little bit, just every day is a different level of exposure that that I am grateful for.
Mm-hmm. So through all of this and everything you've experienced in the past couple of months, what are some of the biggest things that you've learned?
A lot of things, even down to as simple as, everyone in the community is extremely generous, and that is awesome to be able to experience. And I'm amazed by that. Even now, after doing it for several weeks, every day I'm like, wow, that is a lot that you are doing, and thank you. But even some of the takeaways of managing a team, as I mentioned, learning how, especially if I'm under a little bit of stress, how that might come out to others. And maybe sometimes that needs to come out to others to communicate the urgency of something, but also shouldn't come off in a way that stresses other people out. So learning that balance has been a good experience to have. And also just problem solving in the moment. And I know that as a Minnesota alum, that problem solving is something that we pride ourselves in. But this has been a little bit different of, something is coming unexpectedly in 10 minutes. What are you going to do with it? And so just having to really think creatively and on the spot, whereas previously I would prefer to have, a to-do list. This is what I'm doing today, and have an idea of what the day will look like. And I think that my current work environment is probably more realistic to how my career will be. So having this practice has been good for that. And also just learning, I've been able to work with a lot of support groups like materials management, police and security, buildings and grounds, and learning what they're capable of and willing to do, and building those relationships that will last for however long I stay at Mass General, hopefully for a while. they're just some of the nicest people, the most helpful people, and the most creative people. Sometimes I'll explain, we're getting this and we need to do this with it. And then they take it to the next level and make it that much better. So that has been a good lesson.
That's inspiring. Are there things from some of those lessons that you're just going to carry with you the rest of your career?
I hope that all of them will. The relationships and different leadership styles, as well as just being able to be more flexible throughout the day with things that are happening. And also just learning from the Hicks meetings and how prepared everyone is during this time, even though it is challenging and different and more of a drawn out emergency than we've ever experienced before. Just learning from them has been very valuable, and hopefully another emergency like this doesn't happen anytime soon. But if it does, I feel like I would be equipped to help out and do some of the things that have been done now, and also learn how to think creatively for some other needs that might come up.
Yeah, hopefully nothing like this will happen again, but we certainly have a whole generation of healthcare leaders that are prepared to face something like this again if needed.
Yes, that's true.
Well, Riley, is there anything else that you'd like to share with our viewers?
I think it's awesome that fellows have been able to be involved, and even though it's been different than probably what most of us expected our fellowship would be, that it's been in some ways better and provided a lot of opportunities that we might not have otherwise had at this point in our career. So I think that it's awesome that so many of us have been able to be involved.
Yeah. Thank you, Riley. I really appreciate you hopping on this phone call with me and sharing with us some of your experiences. I love hearing about the work that you're doing, and it sounds like they've really been making good use of your talents and giving you plenty of opportunities to grow and develop as a leader. And thank you for sharing that. Thank you for watching COVID Fellows, an Admin Fellow video interview series. Follow Audrey L. Workman on Twitter or LinkedIn for more related content.